So, good afternoon, everyone. After many days, we are uh, catching up live with you. So, let's talk about any doubts that you have in your practice for homeopathy, and what do you say, in your clinical practice. Whatever doubts you have, you can write in comments, and I'll be happy to answer them. So welcome Deepraj, welcome Vaishali, Kona, Sandeep, everyone for this live session. I think I will take one of the live session a week. Abhi, Salve, welcome. So tell me what doubts you have, Abhi, and anyone can ask whatever doubts you have in practicing homeopathy. Best treatment for UTI in infants 1 to 8 years of age. Very good question. So, you need to utilize the symptoms for treating the UTI infection in infants. Peculiarly, if you'll see in female infants, you would find it is recurring, or where is diaper rash there. In those people also in those children also you could find the UTI infections, and you can prescribe remedies like Cantharis, Lycopodium, Sarsaparilla, depending upon those symptoms of it. मुझे एक पेशेंट की नीडल इंजुरी हुई थी. यस, so if you got that type of injury, check for hepatitis B. Okay, other questions. How to make pictures of patient according to Matra Medica? Thank you, Sandy, for this question. So very interesting question. See, how to form. So there are various types of memories we have, right? We have a pictorial type of memory, like whatever we see, we grasp that through our pictorial memory, through our eyes. Then we have our writing memory. Then we have our hearing memory. So, the best way to remember the medicines is remembering them as a patient. And if you correlate that to certain story, then you would remember that thing. Suppose a patient comes to you, I'll tell you, for example, a patient comes to you, he is a child, and he was not able to hear, and he was also having adenoids, and during childhood he fell in a बोरवेल. ऐसा बोरवेल होता है ना, उसमें गिर गया था बचपन में. ऐसा एक बच्चा था, तो उसको हमने दवाई दिए थे. बताओ क्या दवाई देंगे? देयर इज म्यूटिनिज्म विथ एडिनोइड्स. व्हाट इज द मेडिसिन? So in this way you need to prescribe, and all these things you will learn in basic course and our advanced courses. So what is the medicine? He is having mutinism, he is having adenoids. What is the remedy for that? Anyone? Satya Sonakar, Chavi, Mansi, anyone? Anyone in the comments? Agraphis newtons, right? So now you will remember Agraphis newtons. For what? For what will you remember? Tell me. What story did I tell you? Kanishka, Pathu, what story did I tell you? Anyone who remembers? He fell into the borewell. You will remember that? Yes or no? Yes or no? Yes. And then you will remember Agraphis. So you need to create that type of pictorial memory for every medicine, so that you remember that medicine. Getting me? There should be a story behind that. Okay? Yes. Next question. Sir, in acute emergency, Rashmi is asking, sir, in acute emergency or injury or any acute problem, if patient has high intensity of symptoms, necessary to take mental symptom also. See, in these emergency cases, if patient is showing the peculiar mental symptom, you need to take it. You need to take the symptoms which are most presenting themselves. Suppose the patient you are seeing is having acute convulsion attack in front of you in your clinic, and he is doing like this, right? What is the acute picture you are noticing here? What is the acute picture you are noticing here? So this acute observation is very essential. Whatever thing is presented to you in the acute phenomenon is essential. What is he doing in the convulsion? Tell me. What did you observe in the convulsion, in this epileptic attack? Yes? Pooja, Kenu, Anna. What did you observe? Yes, Rashmi, very good. Up rolling of eyes. And what was the second observation? What was the second observation? Tongue protruding. So just two rubrics and you will find the remedy. What is the rubric? Eyes rolling upwards, convulsion during. Tongue protruding, convulsion during. Find out the remedy. So easy. Isn't it easy, Kajal? Prashant? Yes, very good. Next question. So, hope your question is answered, Rashmi. Someone who would like to come live, we will. There are 3 requests. Afreen, Sabah. So, if anyone wants to join live, we will have some chit chat. Or any other queries. Write down in comments your queries, I'll answer them. Altaf, Rasmeen, skin problem. What skin problem, Waghela? Any more questions? Very good. Payal. Sir, what approach should be taken in large recurrent renal stone? Very good. So see, number 1 is your constitutional medicines for recurrent renal stone. Always keep in mind that you are not God. You have scope and you have limitation. Know the limitations. Unless and until you know the limitation, you are not going to be a successful clinical practitioner. अब patient आया 35 millimeter of renal stone in lower calyx. What are you going to advise this patient? Tell me. What are you going to advise? Patient needs the exact ethical treatment on time. You are not God. Don't make unnecessary hazard for patient. Please refer him to surgery. Please. So you need to understand the scope and limitation. But if this type of condition is happening recurrent to him, then you need to prescribe our constitutional medicine. And number two, you can utilize some remedies like calcula renalis. Use it frequently, it will stop the renal stone forming tendency. Okay. Hope it is answered. Someone asked question, dental. Dental, can you again ask the question? जरूर आसिफ समझाएंगे मायाजम हिंदी में. अरे डेंटल, व्हाट वाज योर क्वेश्चन? हाँ, very good. Afrin asks, sir, if someone has problem with certain thing like aversion to onion, then how to manage that case? What do you want to manage? This is a very interesting, where if you get aversion to onion, think like remedies like thuja, lycopodium, and use it in your constitutional remedy. Your remedy cannot change the desire and aversion. Okay, it will just help for you for your prescription. Medicine for high triglyceride. So see, high triglyceride is a lifestyle disorder. So you need to manage the lifestyle of the patient along with the diet, along with exercise and yoga, and then only it can get better completely. Some two questions. Prashant Patil, how can we use calendula Q for selective diabetes along with Yes, we can use internally also and externally also. Calendula will help. Use it bindas, it will get fantastic results. Next query. Next. Over acidity with burps. See, for over acidity, think for remedies like acid sulf, mother tinctures like hydrastis, and remedies like robinia. But all these remedies will not help unless and until you focus on the cause. For acidity, focus on the cause, the thought process, the emotion, the stress, the fear, the dreams. Okay. After injury, one toe with table, there is clot formed. How to deal? So, how is the type of injury? Give arnica 33 hourly. It will help the patient. Gulnaz, some patient is there. Female patient, 50-year-old, having difficulty in standing, sitting, and walking, severe pain, having this type of pain. That she got overgrowth of bone. Can you cure it? Where? What is the place? Overgrowth of bone. Gulnaz, you are talking about the heel pain. If there is overgrowth of bone in heel, there are fantastic remedies in homeopathy. It will definitely help. I am not the person to answer this question, Dr. Annie Optimist. Next. Any remedy for varicose vein. Hama melis, calcarea floor. These remedies will help you a lot. Heel pain. There is a remedy called as Arania diadema. It helps a lot where there is overgrowth on the heel and typical pain. Arania diadema. Next. Shivani, Dinesh, any queries? SLE. SLE, systemic lupus erythematosus, is a very severe condition. I had 2 cases of SLE. Constitutional remedies helped them. One of the case was helped with Staphylococcus aureus. The patient had too much anger issues with her in-laws, and she felt that people humiliated her, her in-laws humiliated her. Treatment was started with Staphylococcus aureus 1M, and later on Staphylococcus aureus LM 0/6 potency was prescribed twice a day, repeated frequently. Patient got better in around 6-7 months of time. Okay, and SLE can be managed. All the autoimmune diseases can be managed very easily with our homeopathic medications. So no specific for SLE, only the constitutional can help for SLE. For him, Afrin. Sir, if patient is feeling better by 6 potency and then we change to 30 or 200, the new complaint occurs, then how to manage that case? So then again you can continue the 6th potency. Don't go to higher potency. Okay. Next. Fractional doses is a big topic. Small lipoma neck, 2 remedies very important. One of the remedies Barita carb. Read repertory. Lipoma or tumors neck, Barita carb. सर आजकल जेनेटिक इंजीनियरिंग की बहुत बात हो रही है. होम्योपैथिक डॉक्टर प्रेगनेंसी से पहले कुछ मेडिसिन देते हैं जिससे बेबी बॉय का बर्थ होता है. ओ माय गॉड, ऑल फूलिशनेस, टाइम पास, वेस्ट ऑफ टाइम एंड एनर्जी एंड मनी. डोंट गेट ट्रैप्ड इन ऑल दिस थिंग्स. ऐसा कुछ नहीं होता है. नोबडी कैन डू दिस थिंग ऑन दिस अर्थ. ऑल वेस्टेज. नेक्स्ट. Echinacea, very good. You can use externally in fungal infection. Ringworm, very good. Yes, you can use. Next. But there is a strategy where to use mother tinctures. All this I have taught in basic course. When to use mother tincture, when to use therapeutic, when to use constitutional. There is a line of treatment. You cannot give mother tinctures in the constitutional medicine treatment. But you can give it when you don't have anything in the case, where the case is just showing you some primary symptoms. You don't have the established diagnosis, you don't have the established symptoms in the case. Yes, it can be cured. For SLE it can be cured, but lipoma I haven't seen good results in my cases for lipoma. So usually I don't take lipoma cases because it is very sticky case. Lipomas don't go. We can just, means I am able to just stop it, the progress, but other doctors may have some good cases with curing lipoma. High TSH with autoimmunity, very fantastic results. I have cases of 150 TSH coming down to normal after our homeopathic medicines in 1 year of time. Okay. Next. Rheumatoid arthritis, how much percentage to chance of cure? 100%. Rheumatoid arthritis cases, I had recently a case better with a very interesting remedy, natrum phos. Rheumatoid arthritis, all the symptoms got better, the report got reversed, the indication I don't remember, but the remedy was natrum phos. Very interesting case. So there are many such cases where we can use life. Chalu hai. नहीं इसमें चालू है, नहीं आप नहीं बैठो. हाँ नेक्स्ट. यस, एनी अदर क्वेरीज? वेलकम मिस्टर जोहेब क्वाड्री, one of my friend. Grace, yes, any question? Batch flower remedies, I am not the person to answer it because I don't use them. Next. Devika, Mirza, Ashish, any queries? Anyone who wants to join live for some discussion? Afrin says we can or can't change the aversion of that patient. Yes, we cannot change because it is his own body. Sir, in TSH with the homeopathic medicine, can we stop the medicine of patient or we have to tell patient to continue the medicine? See, if you are treating thyroid patients, don't stop the medications directly. First, give your remedy, see the symptomatic relief of the patient after your constitutional medicine. Number one. Number two, do the reports after 1 or 2 months after your medicine, and if those things are better, then taper down the other medications which are going down. After tapering, then stop them, and then again do reports in between after 1 or 2 months. And if you see some good results, then again taper down our medications, and in this 1 year of time you can find that the TSH level has gone down and he is better naturally without any other medications. Okay. Sudhami, for homeopathy clinical practice, what are the books? You can read Boric Materia Medica, you can read Kopiker's 100 cases books, and read cases of doctors. Unless and until you read cases of doctors, solved cases, you will not gain the insight of their own thought process. Okay. Medial collateral ligament tear of knee, which remedy is preferable? For tear only, you can use various remedies like Stichta pulmonaria or a Ruta or the symptomatic remedy. But if it is totally ruptured or totally apart in the MRI, please suggest for surgery. Reverence asks, psoriasis since 8 years and I am treating her since 3 months. Now patient complaining of itching increases in winter. So we can, no. So we can give petroleum every winter, aggravation her itching. No, this is a common symptom, Reverence. This is a common symptom of psoriasis. Just find out her constitutional remedy and give her that remedy. She will get better. Don't involve petroleum directly. Under eye dark circle, ऐसा कोई दवाई नहीं है. Tell them to manage their lifestyle, their sleep, their hormonal balance, their tension, their stress, their water level, and it will automatically get balanced. Ankle pain, very good remedies are there. Strontium carb, natrum carb, lidum pal, arnica, depending upon their symptoms. Ruta. Remedy for tinnitus. Tinnitus, homeopathy has very good remedies. I had opportunity to treat many ear patients. CSOM where there is tinnitus, ASM where there is tinnitus. Remedies like Kalimur, Kalifos, Chenopodium, depending upon the symptoms. Pulsatilla, Calibichromicum, depending upon the symptoms. Even the constitutional remedies help, but when in some cases you don't get such constitutional remedies, you need to prescribe a therapeutic prescription and it will help the patient. I use Shobe, Lalita. Remedy for post-traumatic vascular malformations. Remedy is arnica, lowest potency, 6x, 12x, or even mother tincture. Rashi asks, how to take out mental symptom from patient? Hey Bapre, what a question. How to take out mental symptoms? So see, you cannot take out, but you can adapt yourself to so that the patient feels comfortable to answer your queries. I will give you 2 examples. Do you want to learn? Write yes in the comment box. I want to see lot of yes, then only I will tell. There is a secret tool. Only Divyesh want to learn. Divyesh, Rashi, 2 yes we got. We want other people also. We don't just want spectators. We want learner. We want people who take action. 4, 5 yes. It should flood, man. Many people are listening. You should write yes in the comment box if you want to listen. What was the question? Anyone can repeat? Can anyone repeat what was the question which we are going to answer? What was the question? Oh, the question was how to take out mental symptoms of patient. That was the exact question, and I am I like this question a lot. So, see, अगर आप एक दुकान पे जा रहे, ठीक है, और वो दुकानदार आपको पूछ रहे हैं, क्या चाहिए? What will be your reaction, Rutuja, Nitisha, Harshu? What will be your reaction? Siddiq, बताओ. What will be your reaction? And if someone asks, हाँ बताइए ना, क्या चाहिए आपको? How will be your reaction? So number 1, your tone. Okay? Number 2, your words. You should place your words systematically. And abhi suppose you are a cricketer, okay? You are a cricketer and the ball is coming to you from front, right? So आप कहाँ से खेलेंगे? In the same way, how the patient speaks in front of you, you need to put up your language, your tone and your body language. According to that only the patient will try to reply you, try to tell his inside story. वो आके नहीं बता देगा हाँ मेरा नाम प्रसाद है, मेरा गर्लफ्रेंड के साथ ब्रेकअप हुआ, उसके बाद मुझे सोरियासिस शुरू हुआ, ऐसा बोलेगा वो आपको? नहीं ना. You need to become his friend. You need to become that type of partner of him so that he trusts you. And you just have 20 minutes, 15 minutes for that. And unless and until you gain his trust, his faith, he is not going to open up to you. In those 15 minutes, by your thought process, by your body language, by your words, by your tone, you need to make that patient sitting in front of you comfortable. Then only his internal conscience will get opened up to you. Getting me? Yes, no? If yes, write yes in the comment box. I want active participants. I don't want this picture देख के जाने वाले लोग. Yes, good. Right? Very good, very good. So hope you will improve your 2-3 things which I told you today. Hello sir, 40 years female, suffering from facial edema. Last 1 year sir, complaints start after menses every month. You need to do renal profile of that patient, okay, and see if there is some problem in her KFT. If there is no problem in that, take this symptom as a concomitant symptom, and on that base you can prescribe. Okay. Next, anyone other queries? So we will have last two questions. Tell me. Vish, Prasad. Yeah, very good. So any remedy for benign prostatic hyperplasia? So BPH, prostatomegaly, is a very common situation for old age people. So prostatomegaly and urine come in drop by drop. There is a remedy. Prostatomegaly and increase the frequency of urine. There is another remedy. So the common remedies like Sabal ceruleta, then Sarsaparilla, Lycopodium, Baraita carb can help you depending upon the symptoms of the case. Headache during menses, what to do? Headache during menses is a very interesting symptom. Take the rubric, find out the remedy, give the remedy. Spitting on face of people in children. Think about the remedies like antisocial remedies like belladonna. Last question. Medicine for ankylospondylosis. Ankylospondylosis, being an autoimmune disorder, requires a constitutional treatment, but there are few interesting remedies which have focus on the lower back, the coccyx part, or where if in ankylosing spondylitis the patient bends down from his back having a hump back, in this posture he remains, and the remedies like bambusa, remedies like picric acid, oxalic acid have good action on the back. Okay, so let's meet on some another day with some good live session. Until then, join the basic course on HomeoMonk app, the cell on all the courses. Dermatology basic course, repertory course is starting tomorrow. You will get hundreds of discount. This offer is not going to come again. I want every one of you to enjoy this what call as sale. Okay, so thank you Prashant, thank you Bhagyashree, bye bye, let's meet again.